So how to differentiate between cervicogenic dizziness versus just regular other vestibular dysfunction? It's a great question. The main thing, so you have to rule out the VBI first. So you can't, because it's the same position as the Dix-Hallpike technically, right? So your head is an extension and rotation, and if that causes the what is it, 5 Ds, 3 Ns, whatever that is. But that's the same position as the Dix-Hallpike. So what you're supposed to do first actually is a modified version in sitting. So usually what I have patients do is while they're just sitting in the chair, I have them rest their arms on their forearms so that they're a little bit more, they're forward, and when they're talking to you, that makes their head automatically go into extension. But my vestibular system, it hasn't moved. It's still level. It's still, in that plane. And then I have them turn a little bit to the side. So it's kind of mimicking that same position where you're turned and you're cutting off the circulation to that one side. So if they got symptomatic in this position, I would be worried about the circulation, and I probably wouldn't go forward with my Dix-Hallpike testing. So do that first. We should technically do that with every patient. Then with the Dix-Hallpike or even with VOR testing, sometimes you're not sure, is it truly the inner ear, or is it just because they're moving their head that they're dizzy? So to differentiate between that and cervicogenic dizziness, actually I could use so you're going to sit in the chair. So you actually have them, you stabilize their head, and then they turn their body side to side and see if that reproduces their same symptoms as when they were still and they moved their head side to side. So this is called the head-neck differentiation test. So technically, if they were dizzy with just the head movements, but not the body movement, then you would think more vestibular, because it's symptomatic only when the head's moving. If they're symptomatic in both times, then you're thinking more cervical, because in both positions their neck is